But what it really comes down to is COVID doesn't care. So if asbestos didn't care that people might have had asbestos fatigue, but we didn't give up. People are still doing asbestos remediation now. Why? Because it's a deadly, dangerous condition. So we don't have asbestos fatigue. We don't have diabetes fatigue. We don't have, broken hip fatigue. But for some reason, partly because of these atrocious signals that have been sent out by leaders that have minimized and guessed wrongly that this next variant will be benign, that actually, the public has become fatigued because they're hearing different signals. The problem is COVID is still disabling people. And we need to recognize that COVID is airborne, and the best way to prevent COVID, long COVID, is to properly prevent the transmission of COVID itself.
I think the importance of these briefings is partially education, right? I think when we first started these briefings years ago, it was to fill the gap that we weren't getting from public health, from the government. And I think, to be honest with you, as David rightly mentioned, I think when I'm talking kind of Alberta in general, or even the world, politicized something that is actually not political, it's an illness. It became very hard to kind of figure out what the noise was and what's real. And I think, as he rightly commented on, we don't think of diabetes as political. We don't think of cancer as political. We don't think of hips and knees and back pain as political, or even mental health as political. And really, COVID should be no other. When I talk about COVID and when I talk about my long COVID practice, I have no agenda except that the patient in front of me needs some help. I can tell you that the number of patients in my practice with long COVID who aren't working is above 50%. And these are from all various professions. This is not just healthcare. This is from every profession. And until we can get policy change around recognition of long COVID as a disability, or COVID-related injury or illness, things that you may have gotten because of immune system dysfunction, until we can get those things addressed and understood by government and policymakers, we have to keep talking about it. We have to keep getting it out into media. It's things like my patients not getting their CPAP machine covered or their medications covered because it doesn't have to do with COVID, because we can't prove it yet, when all of these things may have started after they got COVID. So, we have to keep talking about, we need to provide that education. And I think this forum allows us to do it in a non-political way, which is really important.
We live in a society where we've decided to be in a collective, to work to help each other. And that society has done very well for us. I mean, look at what we've created. It's amazing. And one of the things that helps us to make better society is better policy. So what are some of those policies that we could envision happening? At least I guess I should speak for myself. I don't think we need to go back ever to 2020, lockdowns, not seeing your loved ones. We actually know so much more about this because we know that it's airborne. We can put in pretty simple measures to mitigate transmission. That means, at the minimum, I would say, improving school ventilation, improving school filtration, putting in thresholds for times where masking would be deemed essential. And, I sound like a broken record, but maybe we should never get rid of masks within hospital spaces until the COVID issue is dealt with, because it seems to be a nidus both for infecting susceptible patients, but also to get things back in the community. So if we really focus on those shared indoor spaces like schools, like hospitals, and other shared indoor spaces, we can make we can make a better space, so that we can do the things that we love to do with the people that we love without endangering them.
If we are a good society, we can use all our knowledge and be visionary and do with air what we did with water and with sanitation in the early 20th century, and sort of go back to 2018, but better. We could have much less all the viruses and bacteria and pollens and such things that transmit via air, and basically get rid of post-viral infection, post-viral complications, like we did with cholera and other pathogens. But now we can do it with pathogens that are in the air.